So prior to our study, we had previously seen excellent results with PD-1 blockade in classic Hodgkin lymphoma, with both pembrolizumab and nivolumab demonstrating excellent results. And furthermore, there had been additional studies demonstrating a biologic rationale for why there was such high response rates in Hodgkin. Specifically, there was chromosomal alterations of 9p24.1, which contains the coding regions for PD ligands 1 and 2, and ubiquitous expression of PD ligands on classical Hodgkin Reed-Sternberg cells. So this was a phase 2 clinical trial, multi-center, performed within the United States at academic centers. We included patients with newly diagnosed, either advanced stage or early stage unfavorable classic Hodgkin lymphoma. Patients were treated with a total of 3 doses of pembrolizumab, followed by PET imaging for our primary endpoint, which was to assess the complete metabolic response rate to a lead-in of single-agent pembrolizumab. Patients then went on to receive between 4 to 6 cycles of AVD chemotherapy, and then had repeat imaging after 2 cycles, as well as at the end of therapy to assess response. And at ASH, we updated our results with longer progression-free and overall survival, and also presented our correlative analyses. So with extended follow-up of 33.1 months, we found that progression-free and overall survival were both 100%, with not a single patient progressing or relapsing or dying from their disease during the follow-up period. We also looked at some correlative analyses, including 9p24.1 alterations, and we looked at FISH for phosphostat-3, as well as PD ligands 1 and 2 to see if either one of these correlated with depth of response. We did not find that there was any correlation between any of these PD-1 pathway markers and depth of response, which ultimately we thought was likely due to the fact that all of our patients had such exquisite responses. So there's now an ongoing larger phase 2 study, the Keynote C11, which is going to look at the same study design of sequential pembrolizumab AVD chemotherapy. The hope is that with continued follow-up, we will continue to see the same excellent results, and we'll be able to confirm in a larger cohort whether or not these results are true. So far, these are probably the best results that we've seen in a frontline study. And so we're very excited to see how this will pan out in the larger phase 2 study.